So I guess when we start speaking, we should introduce ourselves, our name and agency, so that Bethany can get used to who's here in the room with us. Is that right? Anything else on the agenda? Has everyone had a chance to look at the minutes from the previous meeting? Held under the esteemed Fred Hare, who's not here this time. Does all look good? So we need to approve them. Do we hear a motion on the floor to approve the minutes?
Motion. So motion.
That is Dick Hyde with Community Intersections and seconded by... All in favor?
Aye.
Yay. Approved. Any public comments not on the agenda from anybody here? This is like the least attended.
Public.
That's not public, right? Can I share?
Please, this is a sharing time with the circle.
The Tyler Senior Coalition won the transit, small rural transit award for the year. So
It was pretty exciting.
it was very exciting. I was super proud of everybody there.
So what do you attribute your award to? What did you do? Or what
Our
was-
growth was 55% over the last 2 years.
It's huge.
Wow. Just improving the program that was already existing.
Nice.
And additional funding, of course.
That helps.
That helps a lot.
So good. No, congratulations, Maggie. You and Ralph up there. Had a chance to
All the
meet Ralph.
drivers,
And all your
everybody,
drivers.
Everybody, we couldn't have done it without the accounting, without everybody involved. It's good.
It's a long way where you are.
Thank you.
So congratulations.
Gail, I wanted to also just give an update relative to the Peak Ride call center. That's hot. After our last meeting, which was on September the 6th, it was decided to move ahead with the call center. That's a dirty word, sorry. Implement it at Mountain Metro with each of the providers providing staffing for that, proportionate to the call volume that they have. It was a big step forward. It was a good meeting. We had Teague Kirkpatrick from Route Match there to kind of propose some new options that we hadn't seen before, and we're excited to move forward. So the goal date is January 2nd to implement that. And we pretty much had everybody on board, so it was a very positive meeting.
It was. And as Craig, this is off the record, as Craig said, he wasn't there, so it must have been.
Just for everybody's information, the compromise that came forward, which is actually a pretty good one, is that everybody will operate out of the same room, but we will operate out of 4 separate databases. So rather than integrating all those databases together and having the challenges that come with everybody lumped together in one big database, people will continue with their existing databases, but they'll be able to share in a kind of an informal fashion with each other in terms of rides. So it's a great intermediary option. And then if that doesn't work, then we start looking at other options. But I think it's got a pretty high possibility for success. Greg?
The funding that was given was to integrate the databases. If that's not going to happen, the funding needs to go back.
We have to address that, yeah.
So,
I think it
But
was
it-
loosely framed in the grant in that way, and we do meet the grant that we're signing.
Yeah, we looked at that. Teague looked at that. Everybody who was involved looked at that.
so
And-
I'll need to look at it
Yeah,
to make sure.
sure.
Sure. Yeah, I'm usually the one most concerned about the legalities of things.
Yeah.
You know, all these people on the board that are very contract-driven, and so
Yeah.
they're pretty good. It was a great compromise. Thank you.
Mhm.
And thank you for your leadership, Joe.
Yeah. You're welcome.
Anybody else on anything they'd like to share? Maybe an informally, anyone who is, Dennis and Maggie, anyone else who was at the CASTA conference would like to share what you went to or transpired or what you thought about the meeting?
I'm fine.
It was good.
That's good.
I think I walked 7 miles.
Yeah. I think it's always a nice meeting, and it gives a bigger perspective of what's going on at the state level and how they integrate with the FTA. The FTA administrator has moved back to Seattle for Region 8, and so they don't have an interim named yet. They're hoping that if someone steps forward from the, I think they call it the senior executive service level, they could place somebody in that role by the end of October. If not, it'll be a longer process. But right now, the de facto is Brickman or Breckman or somebody, people know of him from the past.
Beckhouse,
Thank you, that's it.
Dave
That's it.
Beckhouse.
Right, so I think that's who's moving things along. There was some discussion about, legislatively what the state might be looking at, and they just want to continue being involved with what I was involved with, the non-emergent medical transportation and how that's going to be transformed into the rulemaking and what that might mean to all of us. There were, Ann or Elena?
I spoke with Elena and her and I had a discussion about what I'd like to see go to legislation. And with 5310, you have, so you have urban, and then you have small urban, and then you have rural. And they can move money up, but they can't move money down. And I'd like to see that changed, where they can play around with that if they needed to. So her and I just speak about it. That might be something.
I think something that I tried to get defined for me, because it was brought up at the Board of Directors meeting, at the PPACG meeting last month, was how all the different committees interrelate to each other. So there's the TRAC, which is the Transit and Rail Advisory Committee. Then there's the STAC, the Statewide Transportation Advisory Committee. Then there's kind of Transit and Intermodal something or other Committee. And then they go work with the Transportation Commission, which then also works with the Transportation Legislative Review Committee. So that's how I understand it kind of works at our state level. So and then we play a role feeding into some of these organizations. So I thought that was a kind of interesting, no wonder why I don't understand it, because I didn't know all the names or the acronyms. So, but that's who's all conversing about, transportation and transit in the state. So, and I think Norm Steen, the commissioner from Teller County, was talking about how the STAC now has an expanded mission in advising the Transportation Commission more. And then speaking with Representative Carver, who's on the Legislative Transportation Review Committee, they are looking for more candid discussions about transportation in the state. And as you might know, El Paso County always feels like we don't get our fair share.
It's because we get 28 cents back on every dollar we pay in.
That's what she's conversing about. So, yeah. So that was kind of, yeah, just to know where we are. That's what I learned.
I learned the same thing.
Anybody else? So now so Bethany or Joe, are people more advised about the Robert Rules of Order when we add things to the agenda? Where are they added to? Anywhere we want them, or at the end?
And you cannot add an action item, you can only add discussion items at the
Okay.
table.
Well, good.
So-
We'll discuss them.
The answer is anywhere within the agenda that you want to place them.
Okay, well, in deference to our guest, I would think, we would like you to be part, and then the additions to the agenda will go after you. Is that okay? So, would you please present?
Before I do, did you get my?
Oh, we didn't introduce ourselves, so is that,
Yeah, I
do
was
you
going
need
to
that?
ask, could we
Yeah.
do an introduction? I don't know who I'm talking to today.
Neither do I.
Get the glasses on, Dick.
Want me to start, Dale? I'm Joe Urban with the Pikes Peak Area Council of Governments Area Agency on Aging.
Joe Vaccaro with Community Transit Coalition, but largely community at large.
I'm Craig Casper. I'm with PPACG. I'm the Regional Transportation Director.
Dick Hyde, Community Intersections.
So Gail Nell's Executive Director with Amblicab.
Erin McCauley, Mountain Metro Transit.
Jacob Manson, Mountain Metro Transit.
Sharon Brown, CityFel.
Dennis Crosser, Valley Senior Services.
Liz Robertson, Division of Oak Rehab.
Brad Bulls, Silver Key.
Do you want me to scream? Maggie Reed at the Teller Senior Coalition.
Awesome. Okay. Is this
Yeah, you're
working?
live.
Great. Okay. So I'm Dana Goldsmith. I'm with the Independence Center in Colorado Springs. I think I recognize some of you from other meetings I've been at, and I also have worked closely with many of your organizations. So if not you, I've worked with someone you know, I'm sure. So it's good to know I'm amongst friends. I know you guys all know Courtney Stone. She works with me through community organizing, and her focus at the Independence Center is accessible transportation right now. And we overlap in a lot of ways. My focus at the Independence Center is the Emergency Programs Coordinator. So it's my job to advocate for people with disabilities in emergency plans. So that's kind of a lofty goal. I don't know how familiar you guys are with some of the hurdles that we face in emergency planning, but during Waldo Canyon it was made quite obvious that there are some major issues with how we handle people with disabilities during an emergency. And we've been working for the last 4 or 5 years to rectify some of that, and we're finally to a point where we can address what I consider to be our next hot topic, which is our transportation issues during an evacuation. I am mostly speaking to Colorado Springs as the city of. I am working to see if there's a potential here that we could actually expand it to the county, to El Paso County, and we are hoping to use what we do here in the Colorado Springs area as a model for being able to expand this into other counties as well. As you probably know, the Independence Center does serve 6 different counties that sort of do a band right across the middle of the central to east part of the state. So this is sort of a guinea pig in a sense, but we have a lot of good opportunity down here to test drive some of this stuff. In my role, I also kind of climb the ladder. I'm all up and down the ladder in terms of working with individual consumers one-on-one, all the way to working with state level and even our Senator Doug Lamborn. So I'm kind of all over the place trying to get more buy-in to this concept and to some of the projects that we're working on, and there's a lot going on. The downside and the upside to what I do is that I'm the only one that does it. So that's why I'm all over the board. And ultimately, the Independence Center has a fairly lofty goal of requesting that our state cover the cost of hiring more people like me to cover more of the state. So right now, I happen to be I moved here when I was 10 years old, so I basically was raised in Colorado Springs, so Colorado Springs gets the benefit of the position for now, and we'll see where it goes from there. So that's a little bit about me. So I want to talk to you guys a little bit about what we do at the Independence Center, what we're working on, and how I could use your help. So if you don't already, we have 4 core programs that we work through: information and referrals, skills classes, transition services, and peer support. We also have our home health care program, which makes us a unique Independence Center. Most just do the top 4 core programs, but we also have expanded into home health care, which gives us an added income from Medicare services so that we're able to fund some of these programs, and that's where my job comes from, is that program. So I'm very appreciative of what they do. They also just purchased a CNA school, so so that's kind of interesting. We're expanding into educating all of our workers. We run skilled and unskilled is what it's called, is my understanding. So we have about 8 RNs that monitor I think somewhere around 8 to 12 patients total, and then we have over 130 what they call unskilled workers, which are people who are friends or family members of a person with a disability, and they operate as their full-time caregiver. So what we're hoping to do is expand the knowledge base for those individuals and get them an extra added incentive to join our to join our CNA school. They will, by doing that and graduating from that school, they'll actually increase their dollar amount per hour that they make for taking care of family members. And so that's kind of the intent with grabbing that CNA school. So I'm excited to see where that goes. That's fairly new. I'm not even sure we've accepted our first class yet. We're still getting the building ready to go. So very interesting. Community organizing, that's Courtney. She does an amazing job with what she does, and I love hearing about what she's doing in terms of transportation, and it's really interesting. I love, her office is just so great because it's full of these great, like, protesting posters, like, make transportation accessible. She's really fun. So sad to see her that she's sick today, so unfortunately she couldn't be here. But and then finally there's me, emergency preparedness. So I work through, like I said, everything from having consumers in the Independent Center that are able to come to me and ask questions and get information about how they can prepare themselves for an emergency, all the way to requesting that there be a voice at the table for people with disabilities at the state level, cities, counties, anybody that is willing to listen to me. Oh, that's my phone. Let me grab that.
We can all sing along.
Is it my... Yeah, that's I should have turned that off. Nobody ever calls me unless I'm in a presentation.
Who can it
Yeah, here we go.
It's kind of why I picked that ringtone, you know?
It's just you.
Okay. Let me turn this off real quick. I apologize. All right. So that's me. And where we overlap is that we both do a lot of advocacy and speaking for people who don't necessarily have a voice. And then another area which I'll get to shortly. So here's what we're working on. These are just a few of the things that I do while I'm there. We have preparedness workshops for people with disabilities and their caregivers to come and learn about how to be prepared for an emergency. We are training all of those home health care folks in emergency preparedness so they can take that information back to their loved ones and their clients and get them prepared for an emergency. We have a personal emergency preparedness workbook, which is a disability-specific little booklet where people can go through and see what specific things they should think about concerning their specific disability and how they can get themselves prepared. We are working on putting together a deaf and hard of hearing emergency interpreting team. We're calling them a strike team. What they would do is if there's an emergency, it can take somewhere up to 3 days to get an interpreter on scene to translate information in American Sign Language. We're working on a strike team that can show up and be operational within a few hours so that they can actually interpret information and make sure that our deaf and hard of hearing community is getting all of the emergency information they need in those first 72 hours. So, yeah, did you
Have you seen the app that interprets?
Hand Talk? Are you talking about Hand Talk? Yes, I have, which is really cool. But it's sort of like all of those language apps. There's some nuance that's not quite right. And while I love it as a stopgap, I think that when you're talking about emergency information, it's very critical that it gets translated properly and exactly the way that it's being said. It can be life or death to say the wrong thing. And so that's been kind of a thing. But I do think that it's a great stopgap. I mean, if you have no options, it's amazing that technology has brought us to a place where we have at least that option. You can use the Google, what do they call it, Google Translate, and you can talk into it, and it'll do any language. And the Hand Talk is a supplement to that. It's that American Sign Language. And so, yes, I've actually used it. My office mate, Matthew Ruggles, is deaf, and he has taught me so much, and I've used it, and he said, yeah, it seems to be pretty accurate. So in casual conversations seems to be okay. I also have been learning from him that American Sign Language has it's just like American English, where you have people in the South speak differently than people in Minnesota, people in the East speak differently than people on the West Coast. There's some nuance there as well, and the HandTalk app doesn't accommodate all of that, so it's good to have somebody in Colorado that talks the way Coloradans do that can do an interpretation service. So we're working on that. It's quite a process, and it's something that they're actually already doing in California, and I was able to visit with their team a couple weeks ago, and it looks like it'll be something that'll really benefit us here, but it's going to take some time to get that developed. So, and then, of course, emergency preparation skills training. So we have the skills workshops that we offer to teach people with various types of disabilities how to live independently. So we do everything from finances to figuring out the transit system to how to cook a meal, how to do laundry, and now we've incorporated emergency skills training into that. So we're doing our first flagship course this month. So this is what I am mostly focused on right now is our transportation resource list. I went to the city of Colorado Springs and found out, I said, how many vehicles do you have that are accessible if there was an emergency and we needed to evacuate? They handed me a list of all the school districts. They have an MOU with the school districts and about 3 or 4 other organizations that they said, we think they might have a vehicle and they may be interested in helping us out if it was a really bad rainy day. But that's it. So I actually started calling those organizations and saying, hey, would you be willing to help? And would you be willing to sign an MOU to service the city if they had a rainy day and needed that assistance? And a lot of them said that due to some of their liabilities and insurances and et cetera, they weren't capable of actually assisting in those kinds of situations. And so they really don't have a list. Which is terrifying, if you ask me. So anybody who has a mobility concern that generally uses public transportation or for whatever reason is incapable of getting out of their home, should their home or neighborhood be evacuated, doesn't have a resource. And as some of you may know, we also had a problem during Waldo Canyon where they had changed the routes in the bus system to accommodate the Waldo Canyon evacuations, and we had left a lot of people waiting at bus stops that didn't know that their routes had changed and weren't able to access their normal doctor's appointments and their day-to-day schedules as a result of that change. So it can be a bigger problem than just the immediately affected area. And so we also had in that instance an assisted living center that had to be evacuated, and they didn't have enough vehicles to evacuate all of their residents safely. So it took quite a bit of time to go back and forth and make trips to get all of those residents safely evacuated, which is scary. In a situation like Waldo Canyon, time is of the essence, and those minutes can make a difference. And so it's really important, I think, that we do something about this. And to me, it's very like I said, very terrifying that people are in a situation where they have no choice. We have what we call a CAG. It's our Consumer Advisory Group, which is a series of people who have different types of disabilities that talk to me about their experiences and give me feedback about what they see in the city or in their neighborhoods or in their community, in their whatever they're in. We have a guy who lives in an assisted living facility, Brookdale Skyline, who they had an evacuation and he was left, they had taken him out of his wheelchair and set him down on a park bench, and then they addressed the fire situation, wrapped up and left him sitting on a park bench, and he couldn't even get back to his wheelchair and get back to his house. It took about 45 minutes for him to get a hold of a neighbor who could bring him his wheelchair, who could help him through that situation. So it's not just immediate danger, which is obviously a problem, but it's also just the comforts and the situation that they're in. It's just not right. So our goal is to have a comprehensive list of transportation providers that are willing to assist individuals with disabilities who may have trouble leaving their home during an evacuation. That's my favorite animation of this whole. So how can you help? So who's a good candidate for this type of list? Anyone who has an accessible vehicle within their organization that is willing to participate. The city is willing to create an MOU with you that fits It will be with the City of Colorado Springs. That MOU will be worked to fit your insurances and liabilities. So if you have a vehicle that can't go more than 15 miles from your organization, if it has to be your driver driving that vehicle, if you can donate the vehicle but you'd like the city to pay for the gas, anything like that, they are willing to work with you on what the nuances of your MOU and create it specifically for what works for you, because it's more important that they have access to options than it is that they have it the way they want it. So what would you be doing? Your MOU would be customized to fit your insurance and liabilities. Special access to evacuation zones would be granted to your vehicle driver. We're not quite sure what that's going to look like. It could be like a magnetic decal. It could be a badge on your driver, where it could be a special jacket, something like that. But you would be given a permission to go into an evacuation zone and retrieve people who need assistance in evacuation. And the IC would be the only organization with access to that list, aside from the City of Colorado Springs, who's creating the MOUs. The reason that's important is because I'm hearing from a lot of people that they're concerned about their competition within the city, knowing what they have, what their capabilities are. So assisted living facilities and home health care agencies don't want to tell people that they have this many vehicles and that kind of thing. So they're kind of hesitant to participate because they don't want us sharing information. So I just want anyone with that concern to know that we are a neutral party. We are just here to help, and the only intention of using your list and your resources and assets is to assist people who need it. And there will be no sharing of information, and your competition and your secrets are safe with the IC. So the other thing that I need your help to do, if you don't have an organization that has accessible vehicles or you can't work out an MOU, is help me spread the word. I need to find who those organizations are, find what those capabilities are, track them down, and court them into hanging out with me and figuring out how can we really make this an option. So really, really important. So I have a bunch of business cards with me today. I am more than happy to share those with you. We can get in touch. If you know of an organization that would be interested in assisting with something like this, we absolutely would like to talk to them. We are, to some extent, expanding into Teller County. I understand that Cripple Creek has a really great, already laid out transportation resource list. And so they've already got it on lock. And so we kind of want to do what they're doing and replicate that throughout El Paso County, which it's surprising to me that a small town like Cripple Creek has more control over that issue than Colorado Springs does. But so what's basically going to happen is I'm going to act as a liaison. I'm gathering names and information and people who have said, yeah, we're interested. We want to be a part of this. We want to make change. And I will be presenting that list to the City of Colorado Springs. The city will call you to set up a time to work out that MOU. Once those have been worked out, they'll make a simple spreadsheet that explains your capabilities and give that back to me. If there's an emergency in this area and the EOC is activated, which I shouldn't use acronyms, the Emergency Operations Center is activated, I have a seat at the Emergency Operations Center, me personally. So I will hold on to the list. I will go to the Emergency Operations Center. If they say, hey, we've discovered that there's an individual with a disability that needs help evacuating, I can say, oh, it looks like this particular agency is able to help. We'll give them a call, see if they have the capability at that moment, and we'll get the ball rolling. So it should be a quick process, and it should be extremely beneficial to the people who need it. So there again is my information. If you'd like to write it down, you are welcome to call me, text me. I like my ringtone, so you are welcome to call me anytime. And email me is always great as well. And then, of course, Courtney will be here. So if you're not sure where to go from here at this point, but you do at some point come across somebody who might want to be a part of this, absolutely tell Courtney. She can get the word to me, and we can roll from there. Is there any questions for me? Yeah.
Obviously, the care facilities are a huge resource because they've got vehicles.
Right.
I think anybody that tells you that that's a proprietary secret is probably just trying to get out of doing the work.
Probably, yes.
But there's central organizations. Have you tried like the Senior Resource Council? Or
We haven't done a whole lot of that. I have a list of 200 home health care and assisted living facilities here in El Paso County. Some of them are run and managed up in Denver, but they have facilities down here, that kind of thing. we've cold called all of those and gotten that response of, oh, we don't share information, we don't divulge, blah, blah, blah. Or they're not interested in sending me to the person who could make that decision. So I'm kind of trying a different route at this point. My first opportunity to talk about this has been here. So
It might be a good option to start at the top and ask for those volunteers from the top down.
Yeah. Yeah, and that's what I'm thinking. I tried to do it the grassroots way, and it wasn't quite working, so we're going to try a new angle. So I think that it offers credibility to what we're trying to do by having other people speak to it. So having people like you in the room that are able to say, oh, I heard Dana talk about this. The Independent Center's got a really good plan. You should talk to them. I think that helps. And I think, standing here, being invited to speak, things like that are a big part of that. So I really appreciate you guys offering me the opportunity to do that. But yeah, I'll absolutely look into that.
Every one of those care facilities is required by licensing to have an MOU for evacuation already.
Most of them do. They have one for their building or their complex. They know how to get their people out, but they're not interested in expanding beyond their own needs. I don't know if it's cost. I'm not sure. I'm not sure what cost there is in having a meeting and signing some paperwork, but there's some concerns. So we're trying to figure out what those concerns are and help them work around it so they'll be more interested in being a partner. So, yeah.
We did a similar plan in 2012 with OEM, Brett Waters at Office of Emergency Management. Have you looked at that or talked to him at all?
No, I asked him about something like that, and he said he wasn't sure what I was talking about, so that's interesting.
We did it for the 2012 regional plan. So
Interesting.
With Mountain Metro.
So if that's
Dave
what
actually was one who-
Toby Blanchard was the one that gave me their transportation resource list that they had up to that point, so maybe it was incorporated into that.
Could be. But I'll take a look to see if I can dig it up. We should
Yeah,
have done it
if
for the
you've got
2040
some-
plan. I just couldn't find it. I just did a quick search.
Yeah, if you have something to go off of, that would be fantastic. Some of the organizations on their current resource list were like the DAV was there because they have an accessible vehicle, but when I contacted them, they said they weren't able to use that vehicle for any more than taking veterans to appointments in Denver. So they're not able to use it for other things. So, yeah.
Have you approached churches throughout town?
Yes. And the answer has largely been no. And I'm not sure on that one exactly why. It was been kind of the person that you need to talk to is unavailable, they'll call you later, and I never get a call back kind of thing. So that's been different. I think that, and this is just a guess, a lot of the churches that have a larger capacity for vehicles end up doing so much in other ways during disaster response periods that they don't have the bandwidth to also contribute vehicles to evacuation, because they tend to collect donations and distribute them. Some of them are open as shelters, things like that, and so they don't want to commit to more than what they can really truly do and have something signed that says we'll do it and then end up not being able to do it. So, yeah.
What about, this seems, I don't know if you've already explored this route, but firefighters and police departments and all of that?
So, because they're busy with the response of the emergency itself, they don't have the bandwidth to provide vehicles. So, yeah, they're usually either standing at a barrier or fighting a fire or, all of that stuff. So, yeah.
So Dana, who at the city are you working with? Are you working with OEM?
Yeah, I'm working with City OEM, with Bart Evans, Toby Blanchard. I've talked about this with Lonnie Insman over at the county level, but he said, see what you can work out at the city level, and we'll see what we can do after that point. So, so yeah, a lot of barriers that I was not expecting. I thought everyone would be really excited to help with this kind of situation, and there's a lot of people saying
I thought
they wouldn't want to.
the Waldo Canyon Fire, Silver Key was called by somebody and put on alert that we might be needed. So we had
Yeah.
to designate so many vehicles to be ready to go. So there was somehow or another, I was in some kind of a loop.
Yeah, I think that they've been shooting from the hip, is what I understand. And so that was sort of somebody in the room said, I have a good idea, let's call Silver Key. But there was no formal list. It was just sort of a, hey, we're in a bad situation, can you help out? And they were willing to do so. That's the other interesting thing is like when we have that story, day, everyone wants to see how they can help, and they're calling us. But prior to that stormy day, and now that it's been a couple of years, everyone's a little bit more complacent about their participation. When you ask them to provide a vehicle, they kind of get this idea, like, how much time is that going to take every single week? Well, it's not. The idea is this is for that really bad situation. This is for those Black Forest fires, those Waldo Canyons, those Manitou floods. This is for that really bad day. And it's only for that emergency. It's not like we're going to call you every time we have a consumer who needs to get an appointment or whatever. It's not expanding your services. It's just offering some help. So it's kind of trying to break down all of these stigmas, all of these assumptions, kind of let them know like what exactly we're working on and why, and get the buy-in that way. So.
Have you approached it without the MOU? I think what you're seeing probably is the fear of signing something.
Signing something? Could be.
Because
Commitment.
during Waldo Canyon, the evacuations were incredible, and it was just people
Yeah, well,
calling
well,
people. They knew,
yeah.
say, hey, can you bring a bus over and get some more folks?
Right.
It was amazing, but it may be the reluctance to obligate to do that.
Yeah, it could be. The problem is that without an MOU, the city has no resources, and that might be why they don't have any now. They're kind of drawing the line of we need to know, like we need that commitment, the commitment that they're afraid to make. They need that from them. We could do some type of agreement or understanding between us, like IC, and other organizations, but my fear is that if we don't have another event here for 10 or 15 years and I've moved on to bigger, better things or less or worse things, that they would actually, that list could get lost in the sauce because we don't have a paper trail to say, here's what we agreed to with these different organizations. And as organizations evolve and change, they can lose track of their agreements. And so that's why the city wants that agreement. And also, I think why they shot from the seat of their pants and were able to still acquire, because Silver Key was able to do something that was maybe like a one-time thing and help out. And
Actually, that was part of the
So-
regional plan that we put together for the regional plan.
it was in the plan.
Yeah.
And they have an MOU, or
It should have been, yeah. That's what I'm
Okay.
saying. We've done it before.
yeah, that's interesting.
Yeah, it wasn't shooting from the hip. It was
Okay.
part of our actual plan.
They should have it in there. So we just finished doing the mass care plan, and I didn't see.
I don't remember signing anything.
Yeah, I didn't see anything in
That's all
terms
I
of
know for sure we
transportation.
had it, so.
There was some talk about, I've seen the MOUs school districts, and they do have some accessible vehicles. So there isn't. I saw the MOUs for that, but I wasn't able to get access to any kind of other resources that they may have already acquired. So that's interesting. I'd be definitely interested to talk to you more about that. Any other questions for me, or?
Thank you, Dana.
Yeah, sure. Thank you guys so much.
I'm going to talk to Scott.
Well, we work for El Paso County.
Okay. Okay. Providing. Just. Is it down here, you think?
Yeah, it's on the Adobe.
It's the Adobe one?
Yeah.
All right, let's go to this one then. Thank you.
Okay.
Where'd it go? Here it is. I'd like to share with you what CDOT is looking at from a statewide perspective to try to coordinate more transportation systems. And I think it might be a way for us to frame our discussions here at the local coordinating council. And so this is on, I believe, the FTA website is what they told me. And so what I'd like to just introduce for today was what we're looking at, and it is an assessment tool, and I think it might be something we might look at on a, periodically or each month go over like one section of this framework. And they use different examples around the country of people that have used it and its benefit. What I was looking at, was, the first is they had us individually as agencies and the state to respond. I think they sent it out to 13 and 9 responded, and so we discussed that. But it looked like we could also implement it here on a local level. And so, let's see. So what happens is that they're asking us these questions, and they're grouped very logically about what we're looking at. So the question is, and there's like 20 or so questions in this framework. But here's an example is, have leaders and organizations define the need for change and articulate the new vision for delivering of coordinated transportation services. And what was interesting is, then they told you, well, this is what it might look like if you were answering this. And so then it was a really small Likert scale of, 1 to 4. And basically, throughout the whole state assessment, we consistently landed in this need significant action or needs action. And so, is the government framework in place that brings together providers, agencies, and consumers? Are the clear guidelines? And so, we might say, yes, we have the local coordinating committee. We do, meet, and we have shared decision-making and roles and responsibilities when we're going over, funding or what we want to do as a community. And I think with the expansion of the stack and the assertiveness of the Council of Governments here about transportation and what they're expecting, and I guess I am referring to Commissioner Steen, I think we can start thinking a little bigger and more structured about what we want to do, and I think this might be the way to do it. So what I'd like to do is just kind of, say this is what we might look at, and I will be happy to send it to Bethany, and then at their next, time, you can send it out to everyone, and we can start to discuss items along this. But are there sustained support for coordinated transportation planning among elected officials, agency, and other community leaders, And so are they active? Are they recognized? Do they know who we are, what we're doing, and how the money is spent? So I thought, and then after reviewing, and then you kind of look at, so if we're looking at where we are now in this evaluation section, well, where do we place ourselves? And so then they went next to taking stock of the community needs and moving forward, and so they had a bunch of questions there. So I just wanted to introduce that to everybody at this time. And suggest that we look at that monthly. Then I wanted to go on this one, and this one is the also from CASTA, the funding distribution policy for CDOT. And as you know, this is the 5311 funds, usually are together with 5310 funds, but the 5311 are for the rural communities, places more like Woodland Park and Cripple Creek, La Junta, some of those other kinds of places around the state. And so what happened was CDOT is looking at changing the way they allocate these funds, and there was a bit of a kerfuffle around the state about how these funds were being pushed around. And so I believe the members of the STAC committee were a bit concerned, as well as the Teller commissioner was concerned about how these funds are going to be distributed. And so I think it's important that we begin to understand what's happening, because it does affect our community, maybe not so much Colorado Springs, because Colorado Springs receives 5310 as distributed directly from Mountain Metro, but for other agencies, this is important. And so the 53 is and so I think what they're trying to get to is more of a formula-based allocation of these federal funds. And currently, it's looking like this, the 15% and 16%, and land use and population and how that's being distributed now. And for people, areas with less than 50,000 in population, they can be used for capital and operating planning or technical assistance. So they're looking at changing how these funds are distributed. And so from the Colorado, the whole perspective, I think this was all operating admin. And then they were looking at, I think this was their inner city buses, and I think they're looking at expanding that, like a Cripple Creek runner, or, the Evergreen down to the Springs, into Denver, things like that. And so then they decided to compare themselves to the U.S. as to how these funds were distributed. And you can see we use a lot more operating than the rest of the country does. And so there was some concern about, is this right? Are we doing the right thing for our communities? And, this might play into, of course, Fountain. So this was kind of an interesting chart. So basically, I think, let me give you some background, or so this would be maybe gossip, but from what I understand is there was, I said, the kerfuffle about how CDOT was looking at changing the allocation for the 5311. There was a lot of pushback, and so now they're being more thoughtful and deliberative about how they might be changing the funding at 5311 perspective. So, and it was interesting, he admitted from the podium that there was a loosely defined merit, when they were allocating funds. So, we appreciated the honesty. And as I said, I think they are being held now to some higher standards. I think especially after FTA was so harsh on them back in last year at this time. They had many findings with CDOT. And so they are changing what they're looking at. And this was where they, it's very hard to read, but so you can see the Roaring Fork Valley got a lot of money, and people down here in Lake and Dolores got a little bit of money for these operating grants at that time. And so, but this is probably easier to understand. So the bigger the dot, the more money they get. And so, maybe, is that you over there? Is that Cripple Creek? I don't know. Is that Cripple Creek? Yeah. So you can see where it was pushed around on the state. So, I thought that this was showing a lot more transparency than we had seen in the past from CDOT. And, and to help us as agencies or communities that are served by these funds to begin aligning with or understanding where that funding might go and what we need to be doing. And so you can see the funding grew in the past by this much, but recently it's only going to grow 11% under the FAST Act that was passed, was it December of 15? And there's a lot more competition for funds. There are a lot more people jumping in the pool looking to access these funds. And that's what I believe is driving Commissioner Steen's concern to make sure that his community will be well represented. And so here's what they were requested in funds, and this was what was available in 2016. And so here you see the people jumping into the pond, and then this is where, some of the contest and the difficult decisions may be made. And so they're under these federal requirements in Title VI that all eligible populations be served, and I think that's why CDOT is looking at more of a formula-based system as opposed to this kind of a more arbitrary merit system. And they admitted this, and I thought that was groundbreaking. And so they were looking at, and for an example, they didn't name the agencies, but here's the different vehicle miles, and who got the money was the one with the least amount of revenue miles and the size, the size of the fleet. so it was, drew into question what was fair and how were the decisions made.
My question to that one would be, where are they? Are those agencies in urban? small
So they're all, this is all 5311.
It's all rural.
It's all rural.
It's all
This was
rural.
all rural. But you can see,
And part of what's driving CDOT is the FAST Act.
Yes.
Mandated performance-based planning now, so they're not, a merit is not allowed. It's benefit cost, actual numbers that CDOT has to use now, so.
Under FAST?
under
That's
FAST,
that
the
FAST.
federal
Yeah,
act.
FASTer is the state, FAST is the federal. Just
I
this is
know,
all.
just to keep us paying attention. Yeah. Enunciate, there you go. So there you go, you're right, Greg, it's all about their performance as part of their distribution process. And so none of it goes to busting. There was some concern about that, because that's an F fund or something. And so, and here's all this stack and track and intermodal committee and transportation committee, and so it's a very now transparent process. And I do remember both Andy Pico, Councilmember Pico, and Commissioner Steen invited everyone to come to the stack meetings, and I believe Representative Carver also thought they were some of the most informative meetings they'd been to, as well as the co-directors of CASTA also thought they were really good meetings. Yeah,
In those meetings, do they have to take minutes?
I believe so. Yeah,
They do?
they're all,
And
Well,
if
not,
I-
well, the Transit and Intermodal Committee as a commission does not.
I'm sorry, which one?
The bottom
This
left
one.
Okay, but the first two,
The stack and track have to, and the Transportation Commission minutes are, motion was made, seconded, and approved. There's no actual what was discussed in the TC minutes, but the stack and track, you can see what's going on.
from my understanding from that meeting, was that CDOT had already spoken with the 4 different agencies or
Organizations.
informally, not, I mean, just going, this is what we think is going to happen. So I was curious to see in their minutes what was spoken.
right. I don't know. I know that we had an informal meeting with Mountain Metro, myself, and one of the CASTA co-directors was Representative Carver, who sits on the Transportation Legislative Review Committee, and she's very interested in this process and having greater transparency. And a quote was, because the people that speak into the Transportation Commission is CDOT, and even with the TLRC is CDOT, and her direct words was, she wanted more talk than just the happy talk. What are the real issues as opposed to what CDOT is presenting to these committees is very filtered. And so she is excited that now this group has expanded, the stack has expanded, not authority, what would you call that? I didn't know, perspective on what they're allowed to weigh in on or look at and examine and advise.
And what, I sit on the stack, so.
Okay, please, yeah.
What was presented relative to the 5311, and it's been a couple of months, I'd have to go back and look through my notes, but that CDOT wants to actually use Bustang, doesn't get the 5311 money, but Bustang is going to tie together the other rural agencies, and so it's beefing up the reach of those agencies into a connected system statewide is what they're going to focus on. So, the Trinidad and Lamar, those systems, we'll try to link them to Bustang, that will then link to, Denver, and create a linked statewide system.
So they did address a little bit of that at the CASTA meeting about the intercity bus system, but I thought nothing was really going to happen until more 2018 timeframe is what we heard.
I don't remember, yeah, that could be, I don't remember the years. But
Did they speak about 5310 rule?
Yep. They do, yeah. Which is that's the urban
Yes,
version of the 5311,
Right.
so. And that pretty much comes to Mountain Metro.
For Teller County,
yeah, you're in the 5311
Yeah, you're in
pool.
5311.
no, I'm in 5310.
Are you really? So Woodland Park is bigger
I'm
than,
in 5310 rural, and I directly go through CDOT.
Oh, okay,
Okay.
yeah, the,
because you're Woodland Park. Yep.
Right.
But I'm interested to see what they presented to you
see,
at this
in,
meeting.
actually, Woodland Park, you're in this interesting, because you're part of the MPO, you're in this bizarre sort of no-person land. So, that, I mean, it is.
And I want Teller
It's like,
County's
it's like
voice
Fountain
to be
is,
heard,
it's,
so.
yeah, it's like how Fountain is.
Yeah, the fountain is
Some
very,
rural and some urban.
Oh, yeah, yeah.
So,
I just want Teller County's voice to be heard on the behalf of 5310 rural, because there's going to probably be some big changes under that. So I'm trying to figure out where all that is at with them. It's not transparent to me what has been presented yet, and it might have been, but I don't have that information.
so what Jeff said this morning to me was the 5310 has not been sanctioned, so I guess it's still in discussion as how they want to
And I just want to
promote
feel
it.
I can be a part of that discussion.
Okay, good. Well, I think this might be one of those ways to do that, but
I think that
I think it would be a good use of our time because it's kind of within the mission. Anyway, so they have been doing these focus groups. I'm not sure focused on, but
it was all of us getting together, the different organizations coming together, and that was the focus.
that was the focus.
Was the grant partners.
And so their approach today was looking at it this way, and now they have changed it. Yeah, I think this is how they were looking at different options of how they might land on how to fund it in the future. And so population is equal, but consider it's different for these resort communities, so they have to try to kind of carve them out. And of the service area, not the county. You can tell this is pretty contentious because as the more people dive in the pool and the funds are shrinking, it gets more competitive. And so as they move, I think, on this continuum of what they did on this merit system to more now this performance and formula-based system, well, we need to help transition agencies because some are going to lose money big and some are going to gain. And
and the burden on the agencies that receive the money is going to be bigger to show they can make that performance.
right. And I always think funding is like a drug. You get addicted to it really easy. It's hard to get out of it. And so this is what they want to look at more. They want to look at this policy framework, which is why they're looking at, the FTA framework that I introduced a little earlier, looking at criteria, looking at this formula, and doing this transition. So that's where we're going with that. It kind of affects, even those of us in the room that are in the urban, it's a preview of what our 5310, I think, is going to look more like, too. So that'll be really fun when we go to write that one this fall or anytime. And they are looking at, and it used to be that CDOT would award, you had to apply for a 2-year time frame, and now they're looking at, never mind, we're just going to do 1 year until we set all this up and understand what we're doing.
I think it's a better idea.
So that's what they're looking at. So it was it was a little, this is a contentious issue. I don't understand it all because AmbliCab doesn't participate in this, but I do know in the 5310 world, if this is where they're heading, it will look different. Yes?
Would you, as a committee, like to have a presentation from CDOT on this? I can get Mark or Tom to come down and just talk to you directly, if that would be helpful.
I'd love to be able to hear about 5310 operating rule.
I'd like to, can we wait till they understand, till they're ready to do 5310 and the 11, and then I think, yes.
I'll give them, send them an email today and see.
Yeah, maybe Jeff will come down, Jeff Sanders, he's the one who presented this at the CASTA meeting.
Oh, yeah, I don't know Jeff, so.
He's a sharp guy. He's a sharp guy. So that's where they're going. But yeah, I think that would be helpful to us and to help us with our planning for the next go-round of funding. So any questions? I mean, I don't want to, but I thought it was informative, because most of us are at the table looking for some of these funds, so. Okay, thank you. Oh, action items for the next meeting, or agenda, topic number 7B, or 7A. Anything else for October? I will not be here at the October meeting, so it could be Fred or Dick leading the meeting. Thank you.
I'm leading it. It's going to be a quick one.
Amen. No, I didn't. Anything else? Meeting adjourned. Record time. Thank you. Thanks, Gail.
I want to know, how much money do they spend to decide how to spend the money?